Good morning, everyone. Thanks, Donna, for the invite. I'm Edwin from Hemophilia Society of Malaysia. So, actually, for Malaysia, we just started to explore on this WBDR, and currently we plan to actually enroll 15 HTC as the first step to participate in this program. As you know, Malaysia is actually divided into Peninsular Malaysia and also Borneo Islands, Sabah, Sarawak. So we actually have around 35 treatment centers. But in order to ask all these treatment centers to participate, some of the medical providers will still be considering, because currently each of these hospitals might have their own system in tracking their patients. So they do not want, as mentioned by some of the speakers, their concern is they do not want to make double entry. That's why currently we actually have one doctor who is heading this initiative from Hospital Ampang, Dr. Jamila. So she will be actually submitting a proposal to the Ministry of Health, to our ethics committee, to get approval before we officially participate. And our strategy is, even though currently we have only identified 15 HTC that is actually agreeable to participate once the ethics committee have approved it. However, for the submission of the proposal, we will actually be putting all the HTCs into the proposal. The rationale is because it's easier for us to put in all the lists, and later if the HTC decided do not want to participate, we can just take out the name, as compared to if we just put the 15 HTC and suddenly there is one HTC that actually decided to participate later, we will have to re-put a proposal again, which will take times. And why we joined this data registry, first of all, is for better treatment monitoring, because with this data registry, as shown by WFH, we can actually easier to extract some of the data available for the doctors and also for the society in terms of advocacy for better treatment. And also it will be more systematic. As I mentioned, currently for some of the HTC, they have been using different systems. So if we can convince them to use this same platform, it will be easier for us to get the same information across the board from each of these treatment centers. And the third one will be to enhance the national data collection so that it will be easier for us to plan ahead to see which area that we can actually improve on for each of the states in the country. And lastly is for advocacy and also for the global survey, because currently for our global survey we have been getting is to pull all this information from each of these HTC centers, and hopefully later on with this WBDR we can actually enhance it further. That means with this WBDR we do not need to give another separate for global survey to WFH, but that one is just our wish list that maybe later on the WFH also can consider on this as well. With that, I have finished my presentation. Thank you.